Good morning officially, everybody. Thanks for joining today's meeting of the Long-Term Care Planning Committee. This meeting is being recorded, so when you speak, it would be helpful if you could please state your name. And today's meeting, I'm really looking forward to. We have, in the last couple of years, because of COVID and other things going on, we've spent a lot of time on the committee doing COVID updates, legislative roundups, a lot of typical work. And I thought that for this meeting, it would be nice to get back to some of the activities that we used to do, where we used to allow state agencies to provide updates on the important programs and services affecting long-term services and supports across the state, so that we can all have an understanding of what's going on in Connecticut to support our long-term care population. So I had contacted the State Unit on Aging and the Department of Mental Health and Addiction Services, and they graciously agreed today to provide us some updates on the programming and opportunities that are going on in their agencies. So with that, I am actually going to kick it over to the Department of Aging and Disability Services, State Unit on Aging. Margie, are you going to be taking the lead on that?
Yes, I am. Thanks, Melissa. And I will get my slides going. If you could just bear with me 1 second. Okay. Okay. Can you see my slides?
Yes.
Okay, great. So now that you've said that, Melissa, some of my update here is really going to be ARPA related, because I feel like a lot of what we're doing, it's all related to our programs too. So hopefully it'll be a combination of a program and American Rescue Plan update, and hopefully that will be helpful. So I can't see everybody, so if I'm missing anything, just let me know, Melissa. So just to get started, so before we launch into the update, I thought it might be helpful to just provide a brief overview of the department and the State Unit on Aging. So Commissioner Porter, feel free to jump in at any time. So the mission of the Department of Aging and Disability Services, which we call ADS, is to maximize opportunities for the independence and well-being of persons with disabilities and older adults in Connecticut. And our programs, policies, and practices are designed to deliver aging and disability services, to provide leadership, to provide and coordinate aging and disability programs and services, to advocate, and to serve as a resource. And our website is really easy to find on the state portal, and here it is. And we have several bureaus that provide programs and services that are listed here. And I know Mairead's on here from the Long-Term Care Ombudsman Program, and I'm here representing the State Unit on Aging. And I apologize if I didn't introduce myself first. Margie Gerunda-Marquette, I'm the manager of the State Unit on Aging. And our State Unit on Aging does planning, developing, and administering programs and services for older adults in Connecticut. Most of our funding comes from the Older Americans Act through the Administration for Community Living to administer programs and services that support older adults as they stay at home longer and age in place. We fund over a dozen programs, including the Elderly Nutrition Program, which is our largest program that serves the congregate and home delivered meals and provides other nutrition services. We also have our family caregiver support programs, and we have our Choices program, which is our health insurance counseling program, and so many others. So the Older Americans Act programs are non-entitlement programs, which means we have a set amount of funding each year that we have to work within. And under the Older Americans Act, our contractors for these services, our direct contractors, are the area agencies on aging. And then the area agencies on aging get the funds out to the community providers at the local level. So under the Older Americans Act, each State Unit on Aging is required to do a state plan on aging. And our 3-year state plan has been extended through September 30th of 2024. And our planning for the new state plan begins this July. So our current plan goals are long-term services and supports, healthy aging, and elder rights. So the department received $873,000 of an allocation of American Rescue Plan funds in 2021 through the state to support family caregivers, especially with more respite services. So this was the first source of the, as we call it, ARPA funding that ADS received. And we already have this project underway, and it ends in December of 2024. So these funds provide additional dollars to the existing state support for staffing at adult day centers through the area agencies on aging. It allowed us to start the Connecticut Caregiver Respite Outreach Project, and this project seeks to increase referrals from diverse and underserved populations to our existing caregiver programs. So this project is a collaboration of the State Unit on Aging, the 5 area agencies on aging, and Connecticut Community Care, and it targets the LGBTQ population and faith-based communities. These ARPA dollars are also providing additional funding to the existing Connecticut statewide respite care program, which is one of our caregiver programs, and it provides more respite services in the amount of $500,000. So it's great that we're able to use these ARPA funds to really enhance and supplement what we're already doing. So we think this is a great way to expand the capacity of what we've been doing and use a new outreach approach to reach a more diverse group of caregivers for our services. So ads also received $15 million in ARPA Older Americans Act Title III funding through the Administration for Community Living. And this was really the next round of ARPA funds for us. And in accordance with the Older Americans Act, these funds were allocated to the area agencies on aging through September 30th of 2024. And these funds do a few things. They expand current service levels under Title III, which includes nutrition services, which again is the home delivered meals. And it also expands other services like caregiver respite services. So this helps to avoid wait lists. It may delay the need for a wait list in these programs. These funds also provide service navigation for older adults and for family caregivers. These are time-intensive services to assist consumers with complex case needs. So each AAA has hired a service navigator to provide services, including application assistance, benefits counseling, options counseling, and case management. These funds also provide services under other special projects within the Title III guidelines. So this really enhances the programming that we already have and also adds some new components as well. So our department received an additional $18.5 million in ARPA funds through Public Act 22-146, and these funds were issued through the state legislature in 2022. They're listed here. The funds are to be committed by the end of 2024, and they can be spent through 2026. So I'll go over each of these items because I know a lot of people have questions about them. So the $3 million for Meals on Wheels, elderly nutrition, was identified as a critical need. So we addressed those funds first. These funds will be used where the elderly nutrition providers need them most, which includes to help with infrastructure, where some needed to repair or replace vehicles and equipment necessary to produce and deliver the meals, and also to help with the increased cost of food, packaging, utilities, fuel, wages, things like that. So we've allocated these funds to the elderly nutrition providers, and we've received their requests for the funds. So the contracts are in process, and once those are executed, the funds will be released. So the second one is senior centers, and to distribute the $10 million to senior centers, we started with holding several meetings with centers to learn about their needs and challenges. And then we calculated the distribution of funds. So $750,000 was reserved for statewide senior center activities, like a senior center summit, a website, media campaign, which the centers were looking for. And we reserved $250,000 for administrative purposes to support the project. And then the remaining $9 million, the 90% of the funds, has been set aside for senior centers and was broken down by municipality. So the allocations were sent out to the municipalities in February, and they went to municipal leaders and senior centers. And the allocations were based on two parts. The first part's a base allocation of $5,000, and the second part is an allocation that used census data on town demographics to bring in an equity component. So the senior center funding may be used for facility improvements and for programming, which are both eligible uses under the ARPA dollars. So the next steps there are to send out an electronic form to collect information about how the senior centers intend to use the ARPA funds. And once their plans are approved, an agreement will be signed and then the funds will be released. And as you can see here, there's an additional $100,000 each for 5 senior centers that was in the budget, plus $57,000 to Ellington as well. And we're working with those senior centers separately. There's also funding for the area agencies on aging. There's $4 million for the AAAs for additional programming and services. And they will also receive $1 million for respite to enhance the current statewide respite care program. So our department also received additional funds around the public health workforce, and those came to us in 2022. So the Administration for Community Livings and expanding the public health workforce within Aging and Disability Networks program provided funding to help cover the cost of staff to conduct public health activities, including activities that address social isolation. So ADS received 5 public health workforce grants through ACL, totaling over $800,000 that go through 2024, and the grants are listed here. So to maximize these funds, we decided to coordinate the various funding under the public health workforce grants. So we pooled funds from 3 of the grants, the State Unit on Aging, the No Wrong Door, and the Assistive Technology, to develop Bridging the Digital Divide, which is a pilot program. And I have a couple of slides on that, which I'll go over. And we were also looking to connect with the Centers for Independent Living tech support efforts under the grant that they have. And then another area of coordination with these funds is to coordinate the state health insurance program funds, which is really our Choices program, and some of the State Unit on Aging public health workforce funds to add more Choices support through the Centers for Independent Living. So I realize there are a lot of acronyms on this slide. I tried to spell out everything that I possibly could. So I think we're used to the acronyms, but it helps to have some things spelled out there. So during the early days of the pandemic, we used some CARES Act funds to pilot a project called Stay Connected, and it screened for social isolation and connected people to technology and trained people to use the technology. It showed us that there was a need for tech support and that access to the use of technology keeps people engaged and connected. So lessons learned from that short-term program helped us start this new program with this new funding source. So since the public health workforce funds were to be used for staffing, we did pool our grant funds and created 2 full-time digital divide coordinator positions, we call them DDCs, to serve Connecticut. And we leveraged some additional admin funds that we had to put this all together to start a 2-year pilot project called Bridging the Digital Divide. And this is a collaboration between the State Unit on Aging, the Connecticut Tech Act project, which are both under ADS, and 2 assistive technology partners, UCP of Connecticut and NEAT Center. And our goal is to increase access to technology to reduce social isolation, increase connectedness, and access to telehealth for older adults and individuals with disabilities. And the webpage is here. And I want to do a shout out to Arlene Lugo, who's the coordinator of the project, and she also oversees the Connecticut Tech Act. So the digital divide coordinators can provide services to individuals as well as organizations. They can provide services to an individual who has technology but struggles to use it and would benefit from training to do all these things, connect to their Wi-Fi, learn to use social media, virtual platforms, use those built-in accessibility features on their devices. And this project can also help with providing tablets and mobile hotspots to people who do not currently have them. And the DDCs also provide services to organizations. If an organization serves adults with disabilities or individuals 60 and older, and their staff can benefit from training to support clients, they can provide this training so that they can learn how to set up built-in accessibility features, learn how to connect using those virtual platforms, and learn how to use social media. So the DDCs are really able to support staff at senior centers, senior housing, disability organizations, libraries, and places like that. So just to give you an idea of how it's going so far, we just started this in October, and actually I have an updated number that just came in last night. We have served 98 individuals already. So as you can see here, most are 60 plus, about 3/4 are women, about 3/4 live alone, and almost half are at or below the federal poverty level. We've also served 17 different types of agencies, public libraries, senior centers, veterans groups, elderly housing, and of those served, almost all of them wanted to learn how to better support clients. In terms of devices, we provided 22 tablets and 2 mobile hotspots so far. So our current state plan is called Building Bridges and Creating Connections. So we recognize that so many agencies, including other state agencies, serve older adults and with coordination and collaboration, we can really better serve people. So to just highlight a few examples from this list, in terms of other state agencies, I know we work with most of the agencies on this planning committee. And as an example, DSS is looking to roll out its SHOW program, its Support at Homes options that focuses on caregiver support. And we've met with DSS about this to coordinate because we have existing caregiver programs, and we want to make sure that, while it's great to have all these additional resources for caregivers, we want to make sure we coordinate and appropriately refer people and assist them through the navigating all these services. And I know my colleague, Erin Levitt-Smith, is going to give an update next from DMIS, and we certainly connect with DMIS, especially on their senior outreach and engagement programs, so we can appropriately refer to their program as well. So I thought I'd just mention the Connecticut Age Well Collaborative. We're thrilled to offer some funding and support to this group and be part of the process that the group has, part of the progress that this group has been making towards livable communities for all. With their new director, they've created an Age Well Academy for learning and sharing best practices and projects so that communities can really support residents of all ages and abilities. I didn't put their website on here, but it's ctagewellcollaborative.org. It was senior centers, given that senior centers are a community focal point and a critical connection for older adults to stay safe, active, and healthy. We're excited to be working more with these centers. We've got the $10 million we're distributing. We had a work group with senior centers and other groups to choose a statewide virtual platform that the State Unit on Aging can purchase so we can support virtual programming such as live and recorded online classes. So this is planned as a way to supplement and support what's already being done out there. We know there's so much already out there for virtual programming. And we're also in the process of hiring a new senior center coordinator, municipal liaison position. We're excited about this new position, which will allow us to go way beyond the limited liaison role that we've been able to offer. And this position came out of the last legislative session. It's an opportunity really for us to dedicate a staff person to supporting senior centers and municipal agents statewide. And another area of collaboration I'll mention is with AARP and Dr. Lauren Tucker from Southern Connecticut State University. And I think I saw Anna from AARP join. So we partnered to offer monthly online tech training and support sessions, as well as monthly tech office hours. So coordination is important. So for coordination with this tech support resource, we've brought in the Connecticut Tech Act, the assistive technology partners from the Bridging the Digital Divide project. So they're all connected and sharing tech resources and tools. And the Tech Act also coordinates with the Centers for Independent Living and their staff who do mobile tech support as well. So there's a lot of good work going on, and it's really important to do the collaboration. So we really seek to complement, not duplicate that tech support work that's being done out there. So please let me know if you have any questions. Please reach out to me with any opportunities that you have to connect and collaborate. I know, as many of you know and have experienced, the State Unit on Aging has really had a lot of retirements since last year, and we've been staffing up again. And I am confident in the next couple months, we're going to be fully staffed and really able to do even more. I think with the small group of staff we had and the amount of money we received, I think our team has done a great job in trying to get things out there and connect everything with our existing programs and enhance what we're able to offer. So thanks for the opportunity to give a longer than usual update than we normally do for the State Unit on Aging. I did want to see if Commissioner Porter is still on and had anything she wanted to add.
I am still on, and you did an amazing job. As Margie said, we have been significantly understaffed, particularly in our State Unit on Aging. So under Margie's leadership, I can't believe how much has gotten done. So as you can see, there's a lot of activity, a lot of great work that's happening in collaboration with all of you. So thank you to Margie, and thank you to all of our partners who have made this a reality.
Thanks so much, Margie. That was an impressive update. That is a lot of work going on in the State Unit on Aging, a lot of important work. And as you were listing all the different funding sources, I was just imagining a lot of contracts. And so I know that behind all of those projects, there's also a lot of administrative work that you're pulling together with very little staff. So congratulations, and thank you for sharing that. And just so everybody knows, I did email out the presentations from today. They're also on the Long-Term Care Planning Committee webpage, so you can find links to the presentations there, and this recording will be there if you want to go back and hear any part of what Margie just said or what Erin Levitt-Smith is going to share in a little while. In the interim, before we move on, does anyone have any questions for Margie or Commissioner Porter? No? Okay. So while Margie was doing her excellent presentation, I saw quite a few more of our committee members join. So I think at this point we have enough people to constitute a quorum, and I would like to just ask Heather Ferguson Hall, who is my colleague at the Office of Policy and Management, if she would please just do a roll call so we can officially get our attendance on the record for today.
Thanks, Melissa. So I will begin the roll now. Senator Hockadell, Representative Garibay.
Here.
Thank you. Senator Seminara, Representative Belinsky. Thank you, Representative.
I'm sorry, I couldn't find the.
I saw your hand raised. Thank you so much.
I am here though. Thank you.
Thank you. Senator Anwar, Representative McCarthy-Vahey, Senator Summers, Representative Claridis Ditria, Senator Lesser, Representative Gilchrist, Representative Case, Melissa Morton, Jennifer Cavallaro.
Here.
Thank you. Dr. Stephanie Bozak.
Here.
Thank you. Margie Girondo-Marquette.
Yep, here.
Kelly Kendall.
Here.
Thank you. Erin Levitt-Smith.
Here.
Thank you. Kim Hirschniak.
Here.
Yeah. Amy Porter.
Here.
Jessica Rival. Lisa Rivers. Michael Santoro.
Present.
Thank you. And Laura Watson. Thank you all. I knew a lot of you were here because you were just presenting, but just to be formal. Thank you so much. And back to you, Melissa.
Thanks, Heather. Appreciate it. So with that, we'll turn it over to Erin Levitt-Smith from the Department of Mental Health and Addiction Services, who's going to provide us an update on the programming going on at her agency. Erin, did you want to screen share, or did you want me to?
You know what? I'm going to spare myself the embarrassment. So yes, Melissa, if you don't mind.
Okay. Not a problem.
So the state of Connecticut doesn't know how inept I am at sharing my screen. I see people laughing, so I'm hoping people share my pain.
I'm just going to find the right, hang on. Here it is. Okay. There you go. Can everybody see it? Yes. Okay. All
right. So now you're going to have, thank you. So you're going to end up having to fast forward.
You just nod to me and I will.
All right. So thank you to Melissa for asking me to present. And Margie, it was a great presentation. So you're a tough act to follow. So the programs I'm going to talk about, this is a really specific presentation that I'm the Director of Long-Term Services and Supports with the Department of Mental Health and Addiction Services. And so when Melissa had asked me to present, I really wanted to present some of our long-term services programs that I thought were kind of relevant to this conversation and some of the things that have happened in our expansion. So the first program is our nursing home diversion and transition program. That program focuses on diverting individuals from an institutional level of care when it's appropriate and possible, and also helping to divert people from an institutional level of care. So whether it be a psychiatric hospital or one of the state's nursing homes. And so our nurses will go in, they do consults across the state for level of care to make sure people are at the appropriate level of care or determine what that appropriate level of care is. And that if our DMIS clients need a nursing home level of care, that it's appropriate and safe and that their psychiatric needs can be met within that nursing home setting. They will also help transition people back to the community, so people with a history of mental illness. And they also work very closely with the state's emergency departments and acute care hospitals to make sure that people are moving through the system and again are in the least restrictive environment appropriate, that people are remaining in the community when appropriate and avoiding unnecessary institutionalization. All right, thanks. Next slide, please. So our program expanded in the last year. So we now have 8 nurses and 3 case managers that cover each of our 5 DMIS regions. We were given permission to hire 2 additional nurses and a case manager. And one of the reasons for that increase is, first of all, the level of referrals we get across the state, but also to really help, we hope, our residential care homes and hopefully the approval from CMS to allow people in residential care homes to reserve to be able to get mental health waiver services within those homes. So in preparation for the trainings that we were doing for the RCH community, and there's a slide later on, and hopefully in preparation for the mental health waiver expansion, which I'll talk about, we were able to hire those additional nurses. So again, just to reiterate that we provide that consultation to nursing home discharge staff. Oops, can you still hear me? My computer is a little glitchy. I think there's systems issues. So, but certainly we're providing that consultation on behavioral health options in the community, behavioral health options in general, treatment options. We're also consulting with community providers. So many of our lead mental health agencies within DMIS or provider agencies that are really struggling with clients with comorbid mental illness and medical conditions. So that the nurses do a lot of consults around diabetes education. That is a big medical issue that we find within our DMIS population. and a lot of education around what can be done with clients around diabetes medications in the community. So again, mental health service linkages, substance use treatment and linkages, and that includes medication-assisted therapy. So we have a nurse that has really studied medication-assisted therapy programs throughout the state and consults with people throughout the state on what's appropriate and helping people link to medication-assisted treatment if it's appropriate for the clients. And again, those residential care home placements. So we have ongoing collaboration with our Money Follows the Person and mental health waiver staff. So often our Money Follows the Person staff will reach out to the diversion nurses to be sure that they're understanding the complex medical needs of clients that they want to transition from a nursing home level of care back out to the community on waiver services. So they work in conjunction with the diversion nurse who will help inform their decision and also help consult on what the appropriate medical treatment would be in the community and whether that can be accessed safely. So that's a huge collaboration and really making sure that clients are safe being out there in the community with community-based services. And they do a ton of level of care determinations throughout the system. Next slide. So what we've been doing with our increase in staff is the diversion program has really worked with DSS on this issue as well, but they have reached out to CARCH, which is the Residential Care Home Trade Association, in developing curriculum, and we have about a dozen training curriculum on things such as boundaries, de-escalation, diabetes education, dealing with challenging behaviors in a congregate setting. So those are just a few of the 12 trainings that the manager, Lorene Gomez, I want to give a shout out to Lorene Gomez, and her nurses have developed for the residential care home staff to better serve the residents. Well, as you can see, is avoiding power struggles, crisis stabilization, working with people with intellectual challenges. These are all trainings that we've developed and are out providing for the RCHs across the state. So we will, if an RCH reaches out, we go out and we provide those trainings. What we have seen happen is they have gotten such great feedback on the presentations that the nurses are now doing presentations, for instance, for acquired brain injury group home staff and other DMIS providers. So they've really developed a more far-reaching hand in providing these throughout the state. They also assist the residential care homes. So we have a mechanism where the resident, oops, can we go back, Melissa? I'm sorry. Where we can go in and assist with crisis stabilization for clients. And what we're hoping to do is be able to provide extra support with our case manager and with our nurse to be able to shore up some services within the RCH so that the RCH remains a viable option for that person and the person doesn't lose their placement within the RCH. And we'll also liaison with the emergency department if it rises to that level. We also have worked in conjunction with DPH, with DSS on the emergency placement of residential care home residents. If there is a need, if there's a crisis in a residential care home, which has happened, and there needs to be emergency placement for a group of residents, they have stepped in as notice and really worked with the Ombudsman's office and DSS to help secure the proper psychiatric care, but also an appropriate placement. Right, thank you. Next slide. So I mentioned that the nurses work in conjunction with the mental health waiver very often. And the mental health waiver is a home and community-based service waiver. that the Department of Mental Health manages in conjunction with the Department of Social Services. And we're one of the few waivers in the country that focuses on people with a primary mental health diagnosis. So we serve people with a serious and persistent mental illness who are at risk of nursing home admission or are transitioning from a nursing home level of care back into the community. So clients opt to get their services in a community-based setting rather in a nursing home setting. It is client choice as to where they get those services, who provide those services, and what services they get. And they create a recovery plan in conjunction with a mental health waiver clinician. But I want to stress that it is client choice is paramount, and that they get to choose how they receive those services and what services they receive in the community. We partner with Advanced Behavioral Health, who is our fiscal intermediary. They've been wonderful partners. They provide the credentialing of all our waiver providers. They ensure fidelity to our CMS application. They do our quality assurance, and they do the training for recovery assistance. We do meet on a weekly basis, DMIS and ABH leadership, to make sure that we're all doing what we need to do when we're abiding by the fidelity of our applications. So it's been a wonderful partnership with ABH. Next slide.
Erin, can we take a pause? I think there's
Sure.
a hand up, if you don't mind.
Oh, sure. Oh, yeah, absolutely.
I'm screen sharing, so I can't see. I think, is it Representative Belinsky? Do you have a question?
Yeah, I have it's probably less of a question than it is just an observation. I mean, the suite of services that are being provided here is substantial. I mean, it's a robust system. Problem is, the awareness of it is not where we probably need it to be. And I'm not even talking necessarily amongst the public, but even amongst legislators. You know, right now we're in the process of doing budgets, and you know, there's things being left on the cutting room floor, and typically these types of services, you know, they go to appropriations to die. I'm really concerned that, I mean, even somebody like me is learning about critical services to support a population that's actively moving away from institutional care and to the aging in place. Yet, I mean, we're not necessarily aware of all the activity that's going on here. It makes it really tough for us to be advocating for budget resources when we get into this situation. I don't have an exact solution to it, except we have to figure out a way to communicate all of this activity to people that don't necessarily have daily exposure to it. So I'm concerned always, but particularly, you know, in the present time, with making sure that we're adequately resourced. You know, when we have positions that we can't get filled, you know, for folks that are going to interface with, you know, with people in the community, and then we can't deploy that resource at all. Man, I just want to, you know, stand on the steps of the Capitol and start yelling about all the things that we could be doing if all we had was this little bit. And because the asks are not terribly substantial, you know that you guys have been involved in creating these budgets or the proposals, and you know, interfacing with legislators and with the governor. But
so Representative Belinsky, if I can, the waiver, the mental health waiver is not a DMIS program. So as such, it's not funded by DMIS. it is funded through Medicaid. So go ahead, Gia. So it's funded through Medicaid. So when people come out under Money Follows the Person, we get a 70% match from the federal government. When they're on the mental health waiver program, it's a 50% match. And so the money it really is paid through Medicare with this 50% match from the federal government. We have grown, and we are continuing to grow. And I just got approval, and we're in the beginning of the hiring for another mental health waiver position, because we've gotten so many referrals of late and have people waiting to be assessed. So we are in the process of hiring, and we're approved to hire another position that I hope to have on by late spring, early summer. So I appreciate, as you know, I've been with the department over 35 years. So very often mental health, services, we advocate, obviously for more, but the good news is that this isn't a DMIS program per se, and we are getting a federal match, and we are able to expand yet again to make sure we can reach even more people, and also to reach people within the residential care homes. So, and I'll talk about that in a few minutes. So I don't know if that, answers some of your questions.
It answers some of my concerns. I still would like to figure out a way to get the entire body of legislators to understand everything that's being done. And it's even a bigger advantage to be able to tell them that, there's the federal match and it's not actually a budgeted item, but, there are programs that fall out of this that do have state support.
Mm-hmm.
So, we want to just sort of hook to the wagon and make sure that folks are aware of programs that they're not necessarily aware of right now. So, and again, it's a lousy question because it's so rhetorical, it doesn't have an answer.
And I will say also, I do send an annual legislative report on our, and actually I'm going to be starting to write that pretty soon. So I can be sure that we get a copy to you if you want, but there is a report that goes annually to the legislature as well. I believe it's appropriations and human services, if I'm not, or maybe it's human services.
All right, great. Thank you very much.
Sure.
And also Representative Belinsky, another resource that we have that you might find helpful if you're looking for just a quick snapshot of some of the long-term services and supports being provided. You're hearing a more in-depth update here today from some of the agencies, but every 3 years, this committee puts out a 3-year plan on long-term services and supports to move the state forward. One of the things included in that plan that I think you and other legislators might find interesting are particularly the appendices that list out various state programs, their funding sources, how much they spent in the last fiscal year. And we update that appendices annually as part of a report update. So you can go right on, I can send the link out with the minutes. But I think you might find that helpful to get a snapshot as well of where the money is going. You're welcome.
That's great. Does the link also include the number of folks serviced or anybody that is not serviced because we don't have the money to be able to provide that service?
So that part's tricky. We don't capture the unserved. What we do capture in the appendices is the number of Connecticut residents that have been served by the programs in that fiscal year and the dollar amount associated. We do not capture things such as waiting lists for the waiver programs and how many people might be on a waiver. That would have to come from the individual agencies, but this could give you a starting place to know where to go to dig deeper into that type of question. And I'd certainly be happy to answer any questions you have once you look at the report as well.
Thank you so much.
You're welcome. Erin, would you like me to go back to sharing?
That would be great. Thank you.
Okay. Okay. Did I go to the next slide or are we still?
I think we can. Yes.
Okay.
Oh, I think yeah. All right. So I mentioned that it's really recovery oriented client choice. Oh my goodness, I'm sorry. So it's really what we provide is intensive rehab skill building in the participant's home. Or it could be other community settings. So for instance, staff can take clients grocery shopping or bus training. So it really is either in the home or a community setting of the client's choice. We pay particular attention to the psychiatric and medical needs and substance use needs if a person has a dual disorder. Oh my goodness. Again, it's really recovery. And we're hoping what we do by the skill building is give people the skills necessary to not need this level of care. And so we do discharge people from the program who actually have improved their level of care to the point where they don't require our services. And people, I forgot to mention, really need nursing home level of care. And we have an assessment form. And our clinicians go in and assess that needs or cognitive needs and put them at risk. And so hopefully we're getting them better so that they don't need that level of care and that they can live even more independently in the community. I mentioned the person-centered planning. Again, it's a recovery plan that our clinicians do in conjunction with the client that specifies client goals and client objectives that they want to meet during their time on the waiver. We also have peer supports that we can utilize, and they've been trained and certified in peer support programming. And we think it's important to have people that have lived experience be able to work with our clients and offer that level of support. Next slide, please. Oh, okay, it did not move forward on my screen, so.
Can
There we
others
go.
see? It's the
Can others-
eligibility slide.
Yeah, so
Okay.
just to, it is, people have to meet, they have to be 22 years of age and older. We do not have a cap. So we have people in their 80s on the mental health waiver. They have to have or be eligible for Husky C. They have to voluntarily choose to be part of the program. This cannot be forced on them. Again, it's client choice. And they have to have diagnosis of a serious mental illness. The nursing home level of care, as you can see, it's meeting 3 critical needs like bathing, dressing, feeding, meal prep, medication, transferring, and or for cognitive deficits. So those have to be met in order to gain access onto the mental health waiver. And as you can see, when we talk about serious mental illness, we're talking bipolar disorder, schizophrenia, major depressive disorder. That really would qualify them. Next slide. It could be my computer's probably very slow.
You're actually breaking up quite a bit. Yeah.
Okay, I'm sorry. I can repeat if people. These are the services that we provide, and we just added last year. We did our 5-year application to CMS, and so did I even put it on here? It is not. We added in-home counseling services to our array of services. Most of the services that we provide that clients really want or need are the recovery assistant and community support program, which is case management and home delivered meals. Those would be the top 3 services that we provide, but we provide all these services. And as long as the plan meets cost neutrality and is under our cost cap, they can get any and all of these services that they deem necessary to remain in the community successfully. Next slide. Okay, there we go. So our senior outreach and engagement program is, as Margie had mentioned, we work with the State Unit on Aging and other agencies throughout the state. The mission is really to engage and outreach to older adults that are at risk due to their behavioral health and substance use treatment needs. We have programming expanded, so we had one staff in each
We
of our
lost
regions.
you for a second there.
I'm sorry,
Erin.
Okay,
Yeah, that's
so
okay.
so where did it, so the
So
programming
maybe
and,
just sum up what the senior outreach and engagement is, and then
okay, so
in
it's an
case we lose you again.
okay, I'm sorry, I know.
That's okay.
So it's an outreach and engagement program. So we're really, our goal is to reach out and engage older adults that are really struggling with behavioral health and substance use needs that are underserved or not served at all, or are in a crisis and require additional mental health or case management services. We are in all 5 of our DMIS regions. We had one staff. We just expanded March 1st for an additional staff in each of our 5 regions. 3 of the programs already have people on board. The other 2 programs are interviewing now. So we will have 2 staff to cover each of the regions. So we're very excited about that. And that really was born out of a grant from SAMHSA, the coach grant, and just the need to be able to provide services to more people and to do more outreach. What we help with is linkages, so really identifying what their urgent needs are, going in and stabilizing, and then being able to link people to long-term services. So this is meant as a link and short-term program to be able to link people to longer-term programs that really meet their behavioral health and substance use needs. And it really, we help on a whole host of issues, housing, entitlements. We can work very closely with a diversion nurse program if there's medical needs that are presenting, and the nurse can go in and work with our senior outreach staff to, again, determine the most appropriate level of care. So we're very happy to have expanded this program very recently. I think, and that is my contact information if people need to reach out or have other questions. All of this information is also on our DMIS website.
Thanks so much, Erin. That was a great presentation, and I know you were doing it with internet connectivity challenges, so I really appreciate you persevering. Does anyone have any additional questions for Erin? No? Thanks so much, Erin. You guys are doing great work at DMIS, and particularly happy to see the senior outreach and engagement program expanding. It's such an important program, and I don't think as many people know about it as should, and so I'm really glad you highlighted it here today. So with that, I'm going to move on to member updates and announcements. Do any of our planning committee members have any updates that they would like to share? Announcements? No? Oh, okay. And then how about the Long-Term Care Advisory Council? We have folks here from that. Michael, I see you're ready to share something. Go right ahead.
Yes, thank you very much, Melissa. I appreciate that. And thank you also to Heather and Margie and Erin. So I just wanted to share an update. We had a meeting of the Long-Term Care Advisory Council back in December. We're going to have our next meeting planned for March 28th at 1 p.m. and I'll be sending out invitations and an agenda for that in the coming days. And as a side note, through our work on the commission, we've been very busy with the legislative season, and also we are finishing up the work on the statewide senior center work group. We have a report that's being finalized now. It's about 50 pages, and we're very excited to be turning that in. And otherwise, that's our brief update for today. Thank you very much.
Great, thanks so much. Any other members of the Long-Term Care Advisory Council have anything they want to add? Hey, how about other business? Anyone have anything else they'd like to raise before the planning committee? Nice quiet group today. Everybody wants to get their extra hour. So our next meeting is going to be Tuesday, June 13th from 10 to 12. We'll continue to meet via Teams. The group had said this was the most convenient way to meet and that they preferred keeping a virtual meeting schedule. So we'll continue to meet this way so that we can get as many participants as possible. June is a fairly interesting meeting of the council because we will be doing our legislative wrap up, where we will go over the long-term services and supports related legislation that's passed during the session. So I encourage agencies, we will of course put together at OPM some highlights and overviews as we do every year, but encourage agencies as we move through the session and items pass, if you have bills that you would like to bring to the group and discuss at the June meeting, shoot me an email after session ends so that we can be sure to put you on the agenda. Also, after sometime over this summer, the agencies will be getting that, if you all remember, we didn't do it during COVID, so it's coming back, the very long-term care plan update chart that has all the programs listed from the plan, and we will be circulating it around to agencies for you to fill out to provide your program updates for fiscal year 2023. And that is all I have. And I hope everybody has a great session, a good couple of months, and we will see you on June 13th. Thanks, everybody.
Melissa, quick question.
Yeah.
Do we need a motion to adjourn?
No.
Okay. Just want to make
Thanks.
sure I have
Okay.
it for the record. Thank you.
Okay, thanks. Bye.
Thank you very much.